If you look at the city's data, there's 2.5 times the amount of call-ins to paramedics and EMS who are doing a phenomenal job. But I mean, this is a huge uptick in use.
In January 2016, Dr. Peter W., the chief medical officer of UMC, sounded the alarm. Doctors saw a huge spike in overdoses suddenly in one weekend. That year, overdoses became the leading cause of death for Americans younger than the age of 50, topping car crashes and gun violence. Accidental opioid overdoses are responsible for more deaths than HIV/AIDS at the height of the epidemic back in 1995. And listen to this, more Americans died of drug overdoses in 2016 than died in the entire Vietnam War. And the numbers are going up. In 2017, there was an increase in deaths, overdoses, and the use of the drug Narcan to reverse overdoses. The CDC calls it a significant increase. Along with the devastating loss of life and potential, hospitals, community services take a personal and budget hit. So joining us now to talk about the impact of the people on the front lines, Special Agent in charge of the DEA New Orleans office, Stephen Azam. Dr. Jerry Satanovich, who is the coroner of Jefferson Parish and an emergency medicine specialist. And finally, Dr. Jeff Elder. He is the director and medical director of EMS for New Orleans. He's also an emergency medicine doctor at LSU Health. Welcome to you all. Narcan, the drug that we get people breathing again so they don't die. Who's using that now?
So first responders in New Orleans have used it over 1,200 times. In the past couple of years, the state has really allowed more first responders to utilize naloxone. And so not only now paramedics, but firefighters, police officers, and even the lay public have started to use it. So we're seeing it really across the community. We're using it actively at New Orleans EMS, as well as with the fire department, and now recently with the police department as well.
And that doesn't cure the addiction, the brain illness of addiction. That just gets the person breathing again so they don't die and then they go back to using.
Right, so the naloxone is really for the acute emergency. That's the medicine that will return someone's breathing and really bring someone back from the verge of death.
Amazing, this is such a big part of your job. And Agent Azam, how many deaths would we have seen in this area if we didn't have Narcan?
You know, Meg, I think the issuance of Narcan, the administration of Narcan is a snapshot to where we would be here in the greater New Orleans area. I mean, the numbers I've seen is up to 4,200 people have been administered Narcan over the last 4 to 5 years. That is a great number, and I think it really kind of shows and illustrates what we're up against locally in addition to nationally. And
earlier, a user told us he had to rob and steal to get the money, and I've had sheriffs, policemen tell me that just about every crime, up in the 90th percentile, somehow is related to drug use. And Dr. Satanovich, what have you seen in the community? More people at the coroner's office?
Sure, more people at the coroner's office. You hear, and you're just on the street, you hear so much more about people using Narcan, getting their overdose reversed. And you know, Jeff can attest to this. You know, when I was practicing emergency medicine, we rarely had to give more than 1 dose of Narcan. And I'm sure that now it's not uncommon to have to use repetitive doses of Narcan because of how potent what's being used is today.
Well, that's the fentanyl that is coming from China over into Mexico and then over the Mexican border, and it ends up here. And the fentanyl is how many times stronger than heroin, and the carfentanil as well? Well,
it can be up to 100 times stronger. Going back to the Narcan, we've administered, our agents have it, because it's not just for the, administered for the public, it's also for law enforcement itself. When folks go to do an arrest situation, there could be some fentanyls in the car, airborne. Next thing you know, you have agents or officers go down. So our agents are carrying Narcan as well. What
stunned me is your DEA agents showed me the suits they have to wear for fear when they go into a home. I mean, it's almost like they're in a steel vault, and the canines, what they have to wear and how they have to wash everything because they could die from a speck.
Meg, this has changed everything about how we conduct search warrants, arrest warrants, searching of vehicles and homes, because we have to take into account not only it going airborne, it was not just for our personnel, but what about the folks that are let's say, in an apartment building? And it has changed the dynamics with regards to how we conduct ourselves in an enforcement operation, because we have to think of the other folks that are around and the contamination.
And I know you have agents on the front line over in Afghanistan where the opioids are grown, that are risking their lives, for us. And Dr. Satanovich, being a doctor, you've said that those little pain charts, they kind of make this, they've kind of got this started with the prescription opioids.
Sure, they call it the law of unintended consequences. It was around 30 years ago they started putting a big emphasis on, did the provider address your pain? And they started with the little smiley face all the way to the grimace, and over the years that was started to be used as part of a provider, physician, PA, NP's job performance. How well did you address pain? So inadvertently, they were pressuring a lot of providers to overprescribe pain medicine, and that's been a big contributor to the problem that we have today.
And neurobiologists have told me never take opioids because of the way it changes your brain, unless you're dying. There's no other choice. They're just so powerful. And Dr. Elder, with seconds remaining, are your men and women strapped? Just, for personnel?
So, we go to these calls every day. We go to multiple calls a day. Sometimes we see spikes in calls, typically depending upon what's there out on the street and what people are buying. And so, last year we responded over 1,200 times to liver naloxone, and that's just the naloxone administrations. There are many, many other countless patients that we see every day that are either addicted or are chronically on these medications.
All right, gentlemen, thank you so much.
Thank you.
Thank you.
Thank you.
Of course, the best way to treat addiction is prevention, to encourage our youth never to try it in the first place. When we come back, prevention programs and policy advocates give us the latest.